vitamin D. So this is a formula that may be useful for you all to remember. Again, just to remember, if you go to the doctor and you do a blood test, it's 30 to 100 nanogram per ml. That's normal. Okay. Now, there'll be some labs that do nanomole. Then it will be a different measurement. It's a bit different, but don't worry. In Singapore, most of us use nanogram per ml. Okay. Then if it's less than 20 nanogram per ml, it's considered deficient. 20 to 29 is insufficient. That's what we mentioned earlier. Normally, if you already have close to like 20 or more, just taking 1,000 a day will be enough, because you will slowly go closer and closer to 30. And then, of course, if you are 30, you also can just take 1,000 a day, because you will be able to maintain your 30 with 1,000 international unit a day. If you happen to take vitamin D2 called ergocalciferol, then you need to take twice the dose, because it's only half as potent. Okay, but I think ergocalciferol is no longer so common. A few years ago, maybe 10 years ago, there wasn't so many vitamin D3 in the market, so we tend to give ergocalciferol. But nowadays, D3 is quite common, we just give D3. But if you use ergocalciferol or D2, you have to double the dose because it's half as potent. Now, if you happen to have calcifidiol, which is the 25-hydroxylated vitamin D, then it's actually 3 times more potent than the vitamin D3. So maybe you can take 1 in 3 days, or maybe you can take a certain period and then you stop for a while and then take again. Okay, so just be aware that the potency is different. All right. Now, there's then another question. If let's say I'm already now only 15, and then I want to boost up to 20, what do I do? So if you want to improve your serum vitamin D by 5 nanogram per ml, you need to take about 3,000 international unit of vitamin D3 a day for 2 months. Okay, but of course, if you take the vitamin that's more potent, like the 25-hydroxy vitamin D or calcifidiol, you actually can top up your deficiency a bit faster. Maybe in 3 weeks, you can top up already. You may not need to take it for 2 months, right? So that is some advantage of the more potent vitamin D. And then, of course, one issue with vitamin D supplementation is that a lot of people forget to take. Okay, but thankfully, I think most of the patients who really know the benefit of some of these vitamin D supplements, they actually take it regularly. But the good thing is that even if you forget, you can always just take another day and it will not be so bad, right? But of course, if you don't take, you will not be effective.